If you are a nursing student studying in Australia, then this video is made for you. Hello everyone, it's Roxy here, and today I'm going to walk you through what a nursing graduate program is all about. If you haven't heard of it before, a graduate program is basically a structured and supportive employment program for newly graduate nurses in Australia. It is designed to help you transition from a student to an enrolled or registered nurse so that you can consolidate what you have learned in the past into real life practice. Most graduate programs run for 1 year and usually include at least 2 clinical rotations across various settings. Those settings can be hospital, aged care, rehabilitation, community health, and so on. Getting into a graduate program can be quite challenging and stressful at times. So, my goal is to make this process feel a little less scary for you by giving you some practical guidance. In this video, I will cover different pathways and how to prepare for a graduate year, the selection criteria, interview tips and tricks, and what happens next if you are successful or not. Let's get into it. The pathway to a nursing graduate program can look slightly different for local compared to international students. So I have separated this into 2 parts. For local students, it's really important that you research the states where you plan to work after graduation. For example, in Victoria, the graduate recruitment runs through a computer match system called the Graduate Nursing and Midwifery Program. I have attached a link here for your reference, but what you really want to focus is the eligibility requirement, application opening and closing dates, match and unmatched positions across the 2 rounds. You can only apply for the computer match in your final year of study, whether you are completing a diploma or a bachelor degree. You also need to be on track to graduate by the end of the year and hold APRA registration before starting work as a nurse. In the first round, you will list up to 4 preferred health services, and you may also need to apply directly to those organizations. Ranking your preference carefully is really important, as it can have a huge impact on your outcome. If you are unsuccessful in round 1, you will be placed automatically in round 2 for any unmatched positions that become available. Make sure you read the website carefully, as it gets updated on a regular basis and provides really clear guidance through each step. If your state doesn't have a computer match or online recruitment system, you will then need to apply directly to your chosen health services. Since the process differs between organizations, it's best to contact them directly to obtain the most accurate information. If you're an international student studying nursing in Australia, the pathway to nursing graduate program is slightly different. To be eligible for the computer match system, you must hold a visa that allows you to work full-time in Australia. And that's why most international students are not eligible for the match. There may be exceptions if you can prove that you have full work rights and are able to meet the working hours required for the graduate program. I strongly recommend speaking with a migration agent if you are unsure about your visa conditions. The good news is that even if you can't go through the computer match, you can still apply directly to certain organizations, particularly private hospitals. Again, this varies between states across Australia, so make sure you reach out early so that you don't miss any opportunities. I studied as an international student myself, and my biggest tip is to pass your English language test as early as you can, because it's one of the key requirements for APRA registration. That way, you can apply for your registration straight after your graduation, but you need to make sure that your English results are still valid while your APRA application is being processed. This also makes it easier to apply for a working visa. And once your work hour restrictions are lifted, you can apply to organizations offering mid year graduate intakes, which usually take place around June or July each year. For both local and international students, I strongly recommend attending a nursing expo if there is one in your country. It's a great opportunity to meet organizations, understand about their programs and recruitment process. Use this chance to introduce yourself and ask for things about their program: clinical rotations, training or study days, retention rates, and the support for the graduate nurses. Trust me, it will save you a significant amount of time and helps you narrow down your choices for where you want to transition from a nursing student to a graduate nurse. You can also attend the hospital's open day if you are really interested in becoming a part of the team. Now, let's talk about preparation for a nursing graduate program. First, focus on building your knowledge and clinical skills. You will soon be working on the floor as a registered nurse. Spend some time on your cover letter and resume. There are so many good tips out there on how to write one, but it's important to highlight why you want to work for the organization and how your values align with theirs. Emphasize your strength or any experience that relate to the role of a graduate nurse. You will also want strong referees, people who have worked closely with you and can speak confidently about your clinical performance. It's beneficial to have a few referees as a backup. Like any other profession, the key selection criteria for a job include professionalism, flexibility, punctuality, teamwork, and strong communication skills. In nursing, they will also be looking at prioritization, time management, patient safety, working within your scope of practice, and timely escalation of care. You will also be assessed on your knowledge and clinical reasoning through a range of interview questions. The interviews of a nursing graduate program usually include two types of questions. First, behavioral or motivational questions. These are all about you, your goals, where you see yourself in 5 years, why you want to do a great year, why you want to work for that organization, and how you prepare yourself for the role, how you handle stressful or highly pressure situation. The second type of interview questions are known as knowledge or scenario-based questions. This may cover topics like national safety quality health service standards, nursing assessments including primary, secondary, or head-to-toe assessments, pharmacology and medication calculations, pre- and post-operative care, falls prevention and management, chest pain nursing management, personal protective equipment, and standard precautions, incident reporting system, types of shock such as septic, cardiogenic, anaphylactic, hypovolemic, or neurogenic shocks, managing a deteriorating patient. Remember, employers aren't looking for perfection. They merely want to make sure that you can practice safely and are eager to learn. So if you are unsure about your answers, you should at least mention that you would ask questions, check organizational policies and procedures, study further to fill your knowledge gap, and escalate any concerns in a timely manner. Finally, here are a few interview tips of a nursing graduate program. Presentation matters. Be open, polite, friendly, and professional. Stay calm and try not to rush your answers. Take your time to read and think before responding. You can ask your employer to elaborate on the questions to seek clarification if needed. If you are in a group interview, teamwork is key. Don't dominate the discussion and don't disappear either. Listen actively, take notes, and contribute when you can, especially if there are any areas that haven't been covered. Avoid repeating what others have already said because it shows that you weren't fully paying attention. Always link your answers back to the question or scenario and explain your reasoning. Well, that brings us to the end of this video. I hope you found it helpful and informative. My final message to you all is, whether you secure a graduate year or not, please do not give up. Although a nursing graduate program is beneficial, it's not the only pathway. There are so many great nurses out there who didn't complete a formal grad year. While you are waiting to secure a nursing position, you could try working through a nursing agency or take on nursing-related roles that involve direct patient care. If you have exhausted other options, consider working interstate or in rural areas where competition is often lower and opportunity is broader. Keep exploring what's out there until you find your path. I wish you all the very best. If you have any questions or comments, feel free to leave them below. I would love to hear about your nursing journey and your encouragement for the new nurses coming through. Thank you for your time, and I hope to work with you one day. Bye-bye.